Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about the differences between working in a nursing home versus a hospital as a nurse. And both of these areas can provide wonderful employment opportunities for nurses, but there are some differences, and I'm going to outline some of those differences in this video. Now, first of all, let's talk about your shifts. Well, at a nursing home versus a hospital, you can have a variety of shifts, and they're both pretty much the same in that sense. For example, my mother worked in a nursing home throughout her career. She was an LPN, and she would usually work a shift like 3 to 11 at that facility. Now, my wife's mother also was an LPN, and she worked in a different nursing home, and they did the 12-hour shifts. So you can have both more traditional shifts and also 12-hour shifts in a nursing home, and the same is pretty much true for hospitals. A lot of hospitals will work on the 12-hour shift scheduling system, but they are starting to incorporate different shifts, and you can find areas even within a hospital where you work a more traditional like 8 to 4, 9 to 5 type job. So both areas do have flexible scheduling in that sense. You can work either 12s or different areas. I would say hospital is probably a little bit more known for the 12-hour shifts, but again, pretty much the scheduling is the same. Now let's talk about patient load. In a nursing home, you tend to have a higher patient load or a patient to nurse ratio. It's not uncommon at all to have up to 15 to 30 patients per nurse in a nursing home, because that's just the way a lot of them are set up. Patients tend to be a little bit more stable, and nurses will generally just go around and administer medications, maybe do a few checks and so forth. In a hospital, on the other hand, you tend to have a lower patient load. In the ICU, you may only have a couple patients. In a progressive care unit, you may have 5 patients perhaps. In a med-surg floor, you may have 6 to 10 patients. It all just kind of varies depending on how the hospital or nursing home runs things, but generally speaking, a nursing home will have a higher patient load per nurse. Next, in a nursing home, you get to know your patients a little more. You can form attachments and you get to meet these people, and you'll know them and their families, and you'll form attachments. You'll know their likes and dislikes. You'll know the medications they tend to require, how they respond to those medications, what health issues that tend to recur in them, and so forth. So you can provide a little bit more intimate and specialized care in that sense. Whereas in a hospital, patients are often discharged within 2 to 5 days in most cases. You may work a shift and meet a new patient, and then the next shift you work, they may already be discharged. So you don't form those deep attachments. You also have a little bit more variety in your patients, because in a nursing home, you're dealing with elderly. Whereas in a hospital, you'll deal with people of different age ranges or different health care needs. And so it's a little bit more variety. For that reason, it's sometimes better to work in a hospital to gain your first experience, because you're going to get a lot of different experience working with those variety of patients. Another thing about the nursing home that I would point out is, even though forming attachments can be a good thing, it can also be a bad thing if the patient passes away. Or you also have the situation where some patients, it's very heartbreaking because they're going through dementia, they're going through Alzheimer's or something like that. And so that can be difficult to deal with. I can still remember going to the nursing home where my mother worked, and there would be an elderly patient sitting there as a little lady, and she would be just sitting there, and she was like, "I'll give you $50 if you get me out of here." And she just kept yelling that all the time. And every time I would go there, over the course of months, she would always be sitting there yelling that out, trying to get anybody to get her out, willing to pay them $50. But I thought that was always sort of weird for me, I guess. But you'll have those patients that have dementia and different things going on. Next, nursing homes tend to offer a little bit higher pay starting out. Now, that's not always true, but they will sometimes offer a little bit more upfront than the hospital will. But you tend not to have quite as good benefits, and you may have less opportunities for growth or advancement in your career. And the reason that is, most nursing home facilities, it's hard to advance because it's just one focus, which is geriatrics, the elderly, and about the only way you can advance in a lot of nursing homes is just if you become like a shift leader or manager. That's about it. Whereas in a hospital, there's a lot of different hierarchy involved. You have a lot of different floors. You have a lot of different management positions. Some hospitals will even own neighboring hospitals in the area, so you can go from hospital to hospital. You can also work in a lot of different specialties to gain experience, and that is very common in the hospitals. You can work, for example, you might work in labor and delivery for a while, then you might change and do ICU or ER or some other area. My wife started out in progressive care, then she went to do stress tests. So there's a lot of different areas for advancement or for changing. You're a little bit more locked in a nursing home. Next, you have not as many resources on hand in a nursing home to help you out as a nurse. And what I mean by that is, let's say you have a patient having an emergency situation. Well, you may have to provide emergency care or CPR or whatever until the paramedics or EMS or whatever arrives. Whereas in a hospital, there tends to be better resources on hand. You can call for a rapid response. You can call for a code blue. A lot of hospitals will have specialized teams available standing by to help you out if you need that. So that's another big thing. And then finally, doctors are not as easily accessible in nursing homes, and it's a little bit harder to get a hold of them to find out what you need to find out. Whereas in a hospital, doctors are often making rounds. It's a little bit easier to get a hold of a doctor in a situation where you need to speak with one or consult with one. So those are some of the difference between working in a nursing home versus hospital. I hope that helps you out. Both can provide wonderful employment opportunities, and they both have their pros and cons. So thank you so much for watching, and have a great day.